Inside Venezuela, it's a losing battle to save those who become ill. The country's crumbling health service has all but fallen. Here the patients are stacked up in corners, knowing the odds are they won't leave here anytime soon. And many won't make it out at all. One of the few medics still working tells us they're only taking emergency cases and everyone has to buy their own medicines, bandages, even gloves. And Gloria can't afford them. She says she needs a metal pin for her broken leg. But with no supplies, she faces a long wait.
And they're using water bottles to keep the weight to try and keep the traction.
Gloria's in terrible pain, wincing continuously.
When do you think she will be able to have the surgery?
Como un mes más o menos, un mes y medio.
About a month and a half.
She'll have to wait a month. Maybe 2 months.
Maybe 2 months.
Whoa.
Or 3 months.
Or 3 months. Wow.
Esto es una tortura china, estar uno así móvil.
It's Chinese torture to be here like that.
They have to care for their own relatives because there aren't enough nurses.
Many of the medics have given up because they can't survive on the minimum wage they're being paid. Those still here are doing it for virtually nothing.
Everything here is so sad. I can not help them because they need help. There is nobody here. They're so
helpless.
See? Yes. And they need our help.
The hyperinflation in the country has virtually bankrupted the hospital. They struggle to buy light bulbs, and parts of the building have had to be boarded up.
Oh, they've had to completely close it? Because you had no supplies?
Porque no hay personal.
This is in an opposition-controlled area, dependent on funding from the central government, but without money for medics or supplies, it's unusable. Dr. Emily Montilla shows us cupboard after cupboard empty of all medicines. She says doctors can't survive on their salaries. She's paid around 5 million bolivares a month. A pack of eggs costs 4 million. Everywhere you turn here, there are heartbreaking stories.
In February.
It was in February.
Oh, there she is, moving around and dancing.
Anjali has a brain tumour. The once active 7-year-old has become almost entirely immobile in just a few short months. But there's no cancer treatment available in Venezuela, once one of the richest countries in Latin America. She wants to take her daughter to Colombia where she can get help there, but she needs the paperwork.
But how are you coping?
Pero ¿cómo hace usted para soportar esto?
Porque mi hija, no soporto. Tengo 2 meses aquí en esto.
Because she's my daughter, she says, I have to support her and do everything I can to help her. We've been here for 2 months. Every second is a titanic struggle for Cesar. His father brought him in with diarrhea, which they couldn't treat, and multiple complications followed.
What did he used to like doing?
¿Qué te gustaba hacer? ¿Qué le gustaba él hacer?
Jugar fútbol.
Playing soccer,
Andar en bicicleta.
riding a bike,
Jugar con la tablet.
playing with the tablet, he signals.
The play.
His father calls him a miracle. Most with him in ICU died. But he needs antibiotics now, which they simply don't have.
Esto es una pesadilla.
This is a nightmare.
Pesadilla porque hay muchos factores.
There are lots of factors.
Sociales,
Social, economical,
político.
political. And the politics are having a brutal impact. For Cesar and his father, the nightmare's not over. Even so, the young boy waves goodbye, nodding as his father asks if he's okay. Alex Crawford, Sky News in Venezuela.